very much indeed for watching Taipan Time. Our next guest in the studio with us today is Dr. Bertram, a renowned surgeon in Hong Kong for medical hair transplant. Dr. Bertram is a name that is rapidly winning friends and influencing people. If you happen to be follically challenged like myself, you couldn't be happier to watch this episode. Ladies and gentlemen, Dr. Bertram from the Medical Hair Transplant Center. Thank you very much, Dr. Bertram. How are you?
How are you?
It's lovely to see you, and thank you very much for taking time to come over and address our audience here. Let's just begin, if I may, with the one important question, and that is, what really is the main cause of hair loss in men today?
Okay. Now, in regard to men, the answer is quite simple. Actually, 95% of men, when they have hair loss, is from a condition called androgenetic alopecia. Now, andro means hormones, genetic means family. So for these people, they're prone to have hair loss, and when they get older, their hair starts to getting thinner and thinner.
Okay. Now, would you say that in cosmetic-driven Hong Kong, hair loss would actually have a huge impact on people's daily lives as well as their professional lives? Now, is that right?
Yes. Actually, the Hong Kong University have done a study, a few years ago, and there are two parts of the study. First, they interviewed the employer and asked about when they have a job interview, would they mind if the applicant have hair loss? And the answer were positive. They say that they will hesitate to employ anyone with hair loss, especially if they have to be on the front line or if they have to represent the company to go for a meeting. They will try to get somebody with a little bit more thicker hair to show more energy and to show more aggression.
Yeah.
Okay. Now, in regard to social interaction, they also interview some women, asking would they mind if they want a boyfriend or even a husband, would they prefer somebody with hair or no hair? Now, the answer is also they prefer people with hair because they think people without hair look older and less attractive. So that was from an actual study by the Hong Kong University.
Okay. But it makes you wonder why someone like me has a job, right? Or why I even got married, isn't it?
I think it's a personal charm, okay? But not many people like you.
Okay. Well, on that note of personal charm, let's say you've got follically challenged people like myself, and we are desperate, we are depressed, we're not happy with the way we look, and then we want to do something about it. So we go out into the Hong Kong market, and then you see the whole market is awash with solutions, and the ordinary Joe like myself wouldn't know what the difference is. So basically, how deep and diverse would you say is the Hong Kong market for hair solutions?
I think the major problem in Hong Kong is, number one, the definition of hair loss. Because when you're talking about hair loss, you're just talking about just no hair. But there are so many different reasons to have no hair. Okay? So if we focus on men, as I said before, 95% have androgenetic alopecia. Nothing you can use can change the gene. You can't expect to buy a $65 shampoo and can work on your DNA. I think we believe it's nonsense. Okay? So first, you need a doctor consultation. I think that's the most important thing, is make a diagnosis what you have. Now, if the doctor says you lack of something, then it's reasonable to take supplement. If the doctor says your hair, your skin is too dirty, whatever, then you look after your hygiene. But if the doctor says you have androgenetic alopecia, then on the market is only two things approved by the FDA from America to work on this condition. So first, you must make a diagnosis what you have. Hair loss is not a diagnosis, it's a presentation only.
Okay, so what are the two things you said?
Okay, now the first one is an oral medication called finasteride. It has been approved by FDA to use, and actually the American Hair Loss Association recommends this to be the first line treatment. Okay, now how it works, because we know in androgenetic alopecia, actually the hair follicles are more sensitive to the man hormone, we call the androgen. Okay, so this medication actually blocks the androgen from working on the hair follicles. So this is the oral medication. Now we have another one called a minoxidil. Now this is a non-specific hair stimulator. It actually works on any kind of hair. Okay, so it can work on facial hair, eyebrow, whatever. So if you apply this one to the scalp, it can help the hair to grow back.
So what should patients be aware of?
Now, this is a very hard question to answer, as you as we understand, there's no regulation in Hong Kong, and I mean, commercial company can tell you whatever they want. It's not like a medical company. They don't need to have any statistic support. I think the most important thing is if you understand that the condition is from gene and from age, okay, don't believe anything that you buy for over the counter can work. So I think the most important thing is before you do anything, see a doctor, make a diagnosis before you spend all your money and time.
Okay. And we'll be right back after the break with Dr. Bertram explaining, doing an actual test right here on a live patient to see whether this patient is in fact a candidate for hair transplant. Following that, we have here in the studios a patient who's just undergone medical hair transplant surgery at Dr. Bertram's, and he's here and we'll be seeing the effects. Hold on to your seats. Don't go away. We'll be right back. Hey, welcome back. Once again, live with Dr. Bertram. In the studios with us is a possible candidate for hair transplant. We'll know whether it's a yay or a nay very soon. Dr. Bertram, take it away.
Now, first, when we have a candidate, asking for hair transplant, the first thing we need to do is to examine the hair at the back of the head. So the first things we do is examine the quality of hair at the back of the head. Now we can see the hair quality is very good, very thick. The density is average. So the next thing is we move on to the balding area and compare the difference. And as you can see, hair here over this area is become very thin, and also the density not very good. So because he has good hair, he's a good candidate. So if the hair quality is good enough, the next things we talk about is, okay, what is the plan? What is your expectation? Because we know that, for example, in this gentleman, the best I can make use may be about 2,000 to 3,000 follicles, and yet on the whole area, he lost at least about 50,000. So how can use the thousands of grafts to replace the whole thing is almost impossible. So we have to use some tricks. Okay, if this gentleman is happy just to rebuild the forelock, it's okay. On the other hand, if you say, Doc, I want the whole head full of hair, then I would say, sorry, we can't do it.
Well, that was the power of science and the technology of hair transplant in motion for you to see. And you'll be happy to know that there was, just recently, there was a surgery performed at Dr. Bertram's clinic in Hong Kong. And the guy who had the surgery is right here on the show with us. He'll be in here in a few minutes. Don't go away. Here we go. There's Shanub right here, live on the studios with us, and he's undergone surgery at Dr. Bertram's just a couple of days ago, a week ago, I would say, and he's right here. Dr. Bertram, take it away.
Okay, now look, we have a young gentleman here, handsome, nice looking, energetic, and a little bit disturbed by his loss of hair, so we try our best to help him. Now, obviously, the area is quite extensive, and I don't think we get enough hair to cover the whole area, so we can do the minimum to achieve the best result. So last week we transplanted about 2,200 grafts on the most important area. We consider the hairline at the front the most important area because this is how people see you. And here we have done the job. And I hope he's happy about this.
Fascinating stuff indeed. Thank you very much, Dr. Bertram. But now a few questions of my own, if I may. Question number one. In busy Hong Kong, people don't really have the time to lie in bed for about a few weeks or something after this transplant thing is over. And then there's a question again about aftercare and stuff like that. So basically, after the hair transplant, how many months, how many weeks, how many days do I have to lie in bed waiting for me to be able, for you to set me free?
Okay, now with the modern technology, actually you can be back to work the second day after surgery. Why the second day? Because the first day you may still be under the influence of the sleeping pills we gave you during the surgery. Most of the people want to stay home a bit longer because they don't want people to know they had a hair transplant. But I think when you come to us, we can work out what is the best plan for you to go back to work without people knowing about it. Yes, you can be back to work in about the second day after surgery.
Really? Oh,
yeah.
That's impressive. Now, the other thing is about aftercare. Because this is, after all, a full surgery. This is no laughing matter here. The last thing you want is somebody with all those stitches and things like that. And what about the aftercare? That's the first thing. And the second thing is about counseling. Is it as important as in any other surgery?
Now, first, in regard to aftercare, the good thing about hair transplant is you don't really have to care much if the job is done properly. So usually, the patient come back on the on the next day for shampoo. We wash the hair for them and come back on day 5, to take off the stitches. That's about all. The next time we see them again will be after 1 month. Okay, so you don't have to come back every week and do something. No, this is the good thing about hair transplant. Okay, and in regard to the last questions, sorry, I forgot.
The counseling.
The counseling, I'm sorry. And first, hair loss is progressive. And for people, if they really want to look good for years, they may have to combine medication and hair transplant together. In that case, the look can maintain for many, many years.
Excellent, wonderful. Well, radio, that was Dr. Bertram from the Medical Hair Transplant Center here in Hong Kong. Thank you very much indeed for coming on the show, Dr. Bertram. And if you have any other questions, can our readers feel free to email, to write to us, and will you answer these questions for us? Will you?
Yeah, I would.
Excellent. Thank you very much. God bless you. Take care and keep the hair flowing. Thanks. Bye-bye.